Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everybody. Welcome to Falling Through the Cracks. Today, I'm talking with Jennifer Block. She is an independent journalist who writes frequently about health, gender, and conflict of interest in medicine. Her articles and commentary have appeared in the Washington Post magazine, Newsweek, The Cut, the New York Times, the Los Angeles Times, The Guardian, Pacific Standard, The Baffler, and many other outlets. Today, we're discussing her book, Everything Below the Waist: Why Healthcare Needs a Feminist Revolution. Jennifer, welcome to the show.
Hi, thanks for having me.
So what inspired you to write this book?
This book really grew out of my first book, Pushed, which is about the medicalization of maternity care in the United States. And, when I wrote that, I was a pretty young, naive journalist and was just shocked that many of the routine interventions in maternity care are not based on evidence and are leading many patients down the road to an unnecessary cesarean. And, I also looked at maternity care from a feminist lens of, we fight for the right to choose to terminate a pregnancy. Do we have the right to choose how we give birth, who attends us, where we give birth? And so when I came out of that experience, and when I came out of writing that book and speaking about that book, I looked up and realized that these themes extend to many other areas of women's health, where the routine care isn't based on evidence, where we are undermining the physiology, and where women's desires and values and choices are not being respected.
So one of the things that I am aware of, actually just from doing this show, I wouldn't have known otherwise, was the science based on women's health, or just the science in general on health, isn't often studied on women. So where does that leave women in the healthcare system if most studies are done on white men?
Yeah, that's our unfortunate legacy that, it wasn't even until the 90s that the NIH required that studies include women. So the joke is that even the lab rats are male a lot of the time. And, this points to, what we know about bodies and the effects of drugs and the impacts of treatments. A lot of that is the dosages aren't changed for us, but the research was done on men. So we've known about, bias in medicine for a long time. And we've known, we've had the data that women are more likely to be misdiagnosed having a heart attack pretty much in any situation. We've known that they've been underrepresented in research. I was also interested in this phenomenon of overtreatment. So not just where we're not represented and where we're being undertreated, but where we're getting a glut of treatment and surgery that's harming us.
Which is true. And, I wrote down a few things from your book, and actually I took a picture of a quote from your book and I sent it to a friend. It was in 1969, we put a man on the moon. In 1982, we invented the internet. In 1998, we discovered the full anatomy of the clitoris. Which I
think that's a quote actually from Huffington Post, right? They have a great site about clitoracy, literacy of the clitoris. But, it's funny because the anatomy was really, this is a story, the clitoris, and I think, it's emblematic of women's health in general. The clitoris is a story of knowledge being found and lost and found again and lost again and found. So, the Huffington Post reported that it took until 1998, but the truth is that in the 1970s, the feminist health activists out in Los Angeles were writing a book called A New View of a Woman's Body that was published, I think, in 1982, ultimately. And they were searching for the true anatomy of the clitoris. And they went to a medical library and looked at all these textbooks and found all these contradictions. Some of the books didn't mention the clitoris at all. Some of them just identified it as this small nub. But then they looked further back in history, and they found that the texts from the 1700s and even 1800s were more accurate, that they actually, the anatomists who were just, dissecting bodies and drawing what they saw, actually saw this anatomy much more clearly. And so those feminists in the 70s and early 80s drew pictures based on those texts and also based on their own investigations of their own bodies. And we have that, that representation of the larger clitoris that kind of looks like a grasshopper. And you can go to the Cliteracy website on Huffington Post to see it. But it's fascinating because it means that our values impact what we know to be the truth, what's in textbooks, what doctors learn, and what informs how they do surgery.
Well, and this to all women would seem like something really important that we should know, but it shows where we've stood in healthcare. I mean, this is one example, and we could probably film many shows of what's happened in, women's history and medicine, and that we haven't been valued. A lot in your book, you talk about how women are, as you said in the beginning as well, too much surgery, too much care, which is actually, from what I gather from your book, hysterectomies and just removing organs. And to me, this is should be the last resort. Why can't we try to get the organ healthy? Why instead of a hysterectomy, why not look at what's causing the symptoms and the problems? But instead of doing that with women, we just remove it. And I feel like we wouldn't do that to men in that same situation.
Yeah, I mean, that's always my question. Would we tolerate this in men? And, it's interesting. People wonder, why don't we have a male pill? And the reason we don't have a male pill is because the studies of male hormonal contraceptives have valued their sexuality very highly, and the studies are really centered around what the sexual impacts are, and they're high. And so that's why we don't have a product, because men are not going to tolerate those kind of side effects. When you look at the research on the female hormonal contraceptives, those questions haven't been asked or have hardly been asked, and yet presumably they have similar impacts. And the minimal studies that we do have on that suggest that hormonal contraception does have those impacts. And for hysterectomy as well, we have our rate in the United States is about twice the rate of European countries, and maybe you actually know the rate in Canada. But we have this tendency to take out this organ. We cut into or remove the uterus more than any other organ, regardless of sex in the U.S., so C-sections and hysterectomies. And so many people I've talked to and so many physicians have insisted to me that, there is no impact on sexual function. Whereas I've talked to plenty of people who've had hysterectomies who have had an impact on their sexual function. And again, this is an area where the questions haven't been asked by the researchers. There's very little research looking long-term at the impacts of hysterectomy on quality of life and on women's sex lives.
Well, and I wonder if women's sex lives aren't being valued as much, because you can, for a man, they still have to have function. A woman can have less desire and still have sex. And traditionally our desires weren't really that important. Way back when we had to do what our husband wanted, which isn't the case anymore. But I remember when they were talking about a Viagra for women, and there was controversy around that. And, I thought, this is great, because there are a lot of women who really want to have the same desire as their partner and they don't, but there was controversy around it. And that to me was baffling, but I think I hear too many stories and voices in clinic to not know that there's a need, but people were laughing about it on the radio. So this shows culturally where we're valuing a woman's sex drive. It's actually not often about us.
Right. And this is one of the themes that I'm constantly teasing out in this book, is about, how much we value women's sexuality and how much we as women value our own organs and physiology, because we can, look at the medical system and at medicine for their role in not valuing our organs. You're 45, you've had your kids. Well, we can just do a hysterectomy, no big deal. You don't need that organ anymore. There's that attitude, but then there's also our attitude and our willingness to go in for these surgeries, and our willingness to submit to take these recommendations and to sort of hand over our agency to the medical system.
Yeah, one thing I also find is before people get to that point, I mean, I've had women who are begging their doctors for a hysterectomy because they've been so uncomfortable for so long. So there is a reason why women get to that point. And I think the other part of that coin is that they're not getting help until they're that desperate. Yes. I've had a lot of women, but, the younger they are, the worse it is for them to get help. They're told, I had a woman who had just had a baby, told by a pharmacist that women her age don't get hormone problems, so that wasn't her issue. And I'm like, okay, well, there's postpartum, plus you're in your 30s, and you're a woman. You can have hormone problems no matter what your age is. And so it was, of course, a man who said it to her. And I thought, this was one of the very first times I had experienced this kind of conversation, and I was baffled that somebody, especially in a healthcare kind of system, would say that to somebody. This isn't your problem. You need to look at something else, maybe some medication, and I think that's how we're often treated. I try to get women to get their hormones tested, and their doctors often refuse because they're not sick enough, or there's just not an issue. Even if we think they have something like endometriosis, they can't get the care that they need until they push for a very long time. And I think this is why women end up in that situation where they're like, yes, please, let's have a hysterectomy because I can't get help otherwise.
Definitely. I very much agree. I talk to so many experts who put it this way, that so many of these diseases are in a blind spot in women's health, especially endometriosis. But yeah, any of the PCOS, hormonal imbalances, the typical thing seems to be that, it's either brushed off or the pill is offered, a hormonal contraceptive is offered as a way to quote unquote regulate the cycle, which may help or may not help the symptoms, but doesn't address the underlying disease process. So one of the things that really surprised me was that endometriosis is more and more being considered an autoimmune disorder, right? That it's this systemic disease that predicts heart disease, maybe predicts cancer, and is definitely a big predictor of infertility. And so women often present with pain, and they're prescribed the pill, and they go for years, maybe 10 years, maybe more, without a diagnosis. And then they come around to wanting to have children and find that, they go off the contraceptive, their symptoms come back with a force, they can't get pregnant, they get this diagnosis, and they're basically told that they're not going to be able to get pregnant. And so the experts I talk to who are doing this really, collaborative, innovative work, pairing up with immunologists and nutritionists and physical therapists and specialized surgeons, talk about how the typical surgical treatment that is being offered to endometriosis sufferers isn't even the right treatment. But the laser surgery is going to create more scar tissue. What they really need is the cold excision surgery, which only maybe a few years ago they said it's a dozen, maybe it's a few more surgeons now do. And whether or not those patients can get to those surgeons and whether it's covered by insurance, there's so many barriers. There are these blind spots where it's just not part of typical OBGYN care. And then the specialists are really, the reproductive endocrinologists are doing fertility medicine. So I talked to a lot of women who felt like they had nowhere to go.
Mm-hmm. I definitely agree. I want to talk about this more. We're going to take a quick break. We're talking today with Jennifer Block, and we're discussing her book, Everything Below the Waist. We'll be back shortly.
Become our friend on Facebook. Post your thoughts about our shows and network on our timeline. Visit facebook.com/Voice America.
What is your level of sexual expertise? Want to find something new? Listen for Sisters of Sexuality every week on the Voice America Health and Wellness channel. There's no judgment here, and every topic is safe and sex positive, so we'll explore them together. It's time to push your sexual boundaries and try some new experiences with your hosts, Taylor Sparks and Parrish Michelle Blair. You won't want to miss a single show. Every Wednesday at 8 p.m. Eastern, 5 Pacific on the Voice America Health and Wellness channel.
Sometimes it just seems that nobody understands. There's one individual who can help. If you're living with somebody who faces challenges such as autism, Asperger's, or other exceptional needs, you'll want to tune into Solutions and Strategies with Dr. Sean, Living the Challenge. Together, we'll uncover a variety of solutions to the challenges faced by individuals, their families, and teachers. Listen live every Thursday at 8 a.m. Pacific, 11 a.m. Eastern, on Voice America Health and Wellness.
Are you living a healthy and fit lifestyle? It's not just related to your physical well-being. It also means a healthier mind, confidence, improved health, stamina, and fitness. Talking with Tremaine brings it all to you. Host Tremaine Ellis, along with her husband and co-host David Ellis, will offer support, advice, guidance, and motivation to keep you in your best shape, both physically and mentally. Talking with Tremaine can be heard live every Wednesday at 6 p.m. Eastern Time and 3 Pacific on the Voice America Health and Wellness channel.
Can you truly expand your possibilities beyond what your normal capabilities are? It's very possible when you can know more, do more, and be more. Tune in each week to Shift Happens with host Karin Weary and co-hosts Ida Serena Lee and Jessica Durrell. The world is waiting for you to show off your unique gifts. It starts with healing yourself mentally, emotionally, physically, and spiritually. Once the scars of our past are gone, we can truly begin to shine. Listen live every Tuesday at 2 p.m. Eastern Time and 11 a.m. Pacific on Voice America Health and Wellness.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings at the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our timeline. Just go to facebook.com/Voice America or search for Voice America.
You You're listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
My co-host Oliver is a 7-pound Chihuahua cross, and he sits through all my shows with great puppy patience. He was super happy when I came home with Carbona Pet Stain and Odor Remover, which is an oxy-powered formula with active foam technology and is engineered to permanently remove pet stains and odor. Carbona is a household brand that has turned their decades of cleaning expertise into products that get the job done fully, quickly, and easily. Although he tries his best, Oliver sometimes does have accidents. I pulled out the Carbona Pet Cleaner and voila, we were stain-free and clean. It was easy to use, pet-safe, and hassle-free. The built-in 2-in-1 brush top tackles stains at the surface and deep into the carpet fibers. It is now my other best friend. Use code FTTC at carbona.com to save 20%. Happy cleaning! Hi, everybody. Welcome to Falling Through the Cracks. Today I'm talking with Jennifer Block, and we're discussing her book, Everything Below the Waist. Jennifer, before the break, you talked about how women were having trouble getting help from their doctors, which is definitely something I've experienced personally. I talk to people on a daily basis where this has happened. But can you just let us know a little bit about what's going on there?
Well, we were talking specifically about endometriosis and PCOS and hormonal problems, right?
Generally about women's health, I find, especially the gynecological issues, but even just, knowing that women have more chronic pain and more autoimmune diseases, and we know that it takes them longer to get diagnosed, I find that, they're getting frustrated with the system. I mean, we know these facts, and it hasn't changed on the end of the patient-doctor relationship where the doctor knows that women are experiencing this. That part I don't think has changed yet for them to change their response when a woman goes in and says, I don't feel good.
Yeah. One topic I looked at was the problem of pelvic pain, which affects so many people, like 1 in 4 women at some point in their lives. And, we're just so behind on researching this and understanding what's going on. And so, physicians don't know what to do about it. The most effective ones, I think, understand that they don't know the answers, and they, try to be with their patients on their journey to find some relief. So they, refer out to pelvic floor physical therapists, which don't exist everywhere. This is a growing field, but hopefully the good physicians look out for those people to refer to. And they are open to working with nutritionists and, psychologists and, looking at it as something that, we don't know the answers to. But the other thing that I was told by multiple OBGYNs was that theirs is a profession that has been stretched very thin. So in the United States, since the 90s, OBGYNs can be reimbursed as primary care providers. And this affected what is taught in their residencies, because now as a primary care provider, that's a whole other piece of the pie. It's a job in and of itself, right? It's a profession in and of itself. So that was added to their plate. And to look back at the history, GYN really grew from surgery, and OB really grew from a takeover of midwifery. And the two were separate for many years. It wasn't until around 1950 that the two combined. And I'm really interested in what impact this had on training and skill, because what these OBGYNs, and there aren't too many who want to talk about this, but they are talking about it within the community a bit. And it's that every other surgical specialty goes through a totally different training process. They train as general surgeons for a couple years, and then they focus on their specialty. They get a 5-year residency of solid surgical training. OBGYN is a 4-year residency, and it's a lot. It's OB, it's GYN, like regular quote-unquote well women care, it's pelvic surgery, it's high-risk OB, it's the hormone piece, the endocrinology piece of it, and then add on to that primary care. And so there's this question that some are asking quietly, but which I'm repeating because I think it's important for people to know, and that is, is surgical skill suffering? Are OBGYNs getting enough training? And this is, it circles back to what we were talking about earlier with hysterectomy being offered as, the only solution. And that by the time women get to that point, they haven't been offered other solutions. They're bleeding, they're in pain, they have endometriosis, they're at the end of their rope. And so I think we need to be asking, what is the relationship there between these failures and these blind spots and the load on the OBGYN field?
Mm-hmm. Well, I think not only the load on them, but the lack of information, because a lot of, as we touched on, women's issues, there aren't a lot of studies on. So endometriosis, the only diagnosis we have is a surgery, exploratory surgery to see if it's there. We don't have a blood test, which is why, like in Canada, it's really difficult to get that. You have to be really, really uncomfortable and push for a long time because it costs money. And, if you can keep the symptoms under control with the pill, which is what they would do after the surgery anyway, then they're going to do that. And this happens with a lot of, women's conditions. If we're just talking about the pelvic conditions, interstitial cystitis and dysmenorrhea and PCOS and endometriosis, et cetera, I find that these women are hitting a wall. And it's not just a wall in that the doctors don't want to care, but they can't because the information isn't there for them to care for them. And I always have this vision because I've been on, Facebook groups where women are so frustrated and they're so lost. So I hear all these little voices saying, this isn't fair. I can't get help. And I wish that those voices were louder, not in these private groups, so that we could be spurred to help them. Because as you said, 1 out of 4 women has pelvic pain at some point in their life. That's a significant amount of our population that needs this help.
Right. And in the U.S., we have the problem of our very broken for-profit system. So, we have the problem of people having no coverage or even limited coverage, and the pressures on physicians to see more patients and, the documentation that has to go on now where, the cliche is that your doctor is facing the computer away from you, typing while you talk and try to connect. Yeah. And so our system is just so broken in so many ways, and it's affecting everyone. But yes, I think that women have these specific issues that, are just so, they can be so debilitating and affecting our quality of life. And, I wrote this book because we're having all these important conversations right now about how our power is being undermined on the basis of sex or race or circumstance. And I think this is part of that conversation. Mm-hmm. Because if we're not healthy, if we're not feeling okay, then our power in society is undermined.
Yeah, well, I agree with that because and I think a lot of women don't feel like they have that power. They don't have the energy, they don't even have power in their doctor's office. I actually learned this from another show I did last year, that it might be important to take someone with you to an appointment. And I coach a lot of women to do this just so that they can have either a witness to a conversation that doesn't go well, or they do find that they're treated differently, especially if they take a man with them. They've got that.
If they take a man, yes.
Yeah. Yeah.
Yes, I don't know if you saw the John Oliver spent 20 minutes on bias in medicine, and had Wanda Sykes come on and talk about her experience of being given ibuprofen, I think, following her double mastectomy. And
that's going to help.
She brought on Larry David. Right?
Yeah.
She brought on Larry David. If you need a white guy who can come with you to your appointment, he's there.
Yeah. Right. But unfortunately, this is the truth. And Wanda Sykes fell in two categories because she was a woman and she's Black. So she was given less pain medication. And I think the studies show that is something that does happen, as if Black women, have less pain or something. But, I have found, since I have coached my patients to do this, that the results are different, and they come back and tell me that, they got further in that appointment with their husband than they did in the 5 previous to that, when, they couldn't get anywhere with their doctor, and then they bring a man in with them who just basically sits there, has no idea really what's happening probably, and just kind of concurs and says, yep. And then suddenly they get appointments and tests and things looked into, and finally figure out what's going on. And it shouldn't have to be that dramatic, but unfortunately this is where we are right now. Yeah,
and I think that, the goal of the women's movement was, the broad goal was to get more women into men's spaces. And so in terms of healthcare, we had this feminist health movement that I talked about in the beginning of our call. But the broader women's movement was really interested in not in the body and in female physiology, but in getting women into men's spaces and getting women into medical school and getting women into this, what was then a very male-dominated profession. And that if we just got more women in, things would be better. And I think we're realizing now, not just in the medical realm, but in our culture at large, we have a president who is vocally misogynist, brags about assaulting women. This is our president right now.
Yes.
We've had Me Too. We've just, I think a lot of the gains that we thought we'd made, we're realizing, we still live in a very sexist society full of sexual violence. And how could this not be, still entrenched in medicine? So even though we have, even though more than half of med students are women now, and something like 85% of OBGYN residents are women, it's still a system that has a very ugly history that's tied to patriarchy and white supremacy and misogyny. And just putting our people in that system doesn't necessarily change it. And so we're still dealing with this.
I wonder if, we've got women in the system, but I wonder if the training has changed so that they're learning more about women's bodies and what to do with them, or if the training is very similar to what it was when it was also men. I mean, the change has to also come from what they're learning, what the train. If they don't tell people in school, doctors in school, that, women actually experience more autoimmune diseases and it's going to take them 4 to 10 doctors to get that diagnosed, let's change that. They're not going to change it because they don't know, and you and I know because we've read these books and interviewed people. But it's gotta be something that is understood by the entire system for it to change.
Yeah, and medicine is notoriously slow in adapting to research and to its culture changing. It's notoriously slow. And I think, we can look at maternity care, which I know very deeply because my first book is all about it. But, we're still, we've had decades of research, the gold standard, randomized controlled trials, telling us that the episiotomy should never have been used routinely. This idea that if you cut the perineum in labor, that it would prevent further tears. You know, women intuitively knew that was wrong. Anyone who's ever sewn knows that doesn't make any sense. And it took it took research, it took decades to prove that it was wrong. But now we know for sure that this is something that should only be used in dire emergencies, that it should not be routine at all. And we still have hospitals in the U.S. where we see like 25%, 33% episiotomy rates. So it takes a long time to change things. And again, I think we have to ask these deeper questions about the culture, because it's even harder to change a culture. But where is the value? How much are we valuing those organs if we're so willing to cut them in spite of the evidence?
Well, yeah, especially when cutting it, of course, can change a woman's life and cause permanent damage. And, childbirth is natural. If it can be done that way, we should avoid those. Some C-sections can be life-saving, but then they've become a quick fix. We don't have time to go into that right now. I went down that road right before our break, but we are going to take a break. I'm talking today with Jennifer Block, and we're discussing her book, Everything Below the Waist. We'll be back shortly.
Become our friend on Facebook. Post your thoughts about our shows and network on our timeline. Visit facebook.com/Voice America.
What is your level of sexual expertise? Want to find something new? Listen for Sisters of Sexuality every week on the Voice America Health and Wellness channel. There's no judgment here, and every topic is safe and sex positive, so we'll explore them together. It's time to push your sexual boundaries and try some new experiences with your hosts, Taylor Sparks and Parrish Michelle Blair. You won't want to miss a single show. Every Wednesday at 8 p.m. Eastern, 5 Pacific on the Voice America Health and Wellness channel.
Sometimes it just seems that nobody understands. There's one individual who can help. If you're living with somebody who faces challenges such as autism, Asperger's, or other exceptional needs, you'll want to tune into Solutions and Strategies with Dr. Sean, Living the Challenge. Together, we'll uncover a variety of solutions to the challenges faced by individuals, their families, and teachers. Listen live every Thursday at 8 a.m. Pacific, 11 a.m. Eastern, on Voice America Health and Wellness.
Are you living a healthy and fit lifestyle? It's not just related to your physical well-being. It also means a healthier mind, confidence, improved health, stamina, and fitness. Talking with Tremaine brings it all to you. Host Tremaine Ellis, along with her husband and co-host David Ellis, will offer support, advice, guidance, and motivation to keep you in your best shape, both physically and mentally. Talking with Tremaine can be heard live every Wednesday at 6 p.m. Eastern Time and 3 Pacific on the Voice America Health and Wellness channel.
Can you truly expand your possibilities beyond what your normal capabilities are? It's very possible when you can know more, do more, and be more. Tune in each week to Shift Happens with host Karin Weary and co-hosts Ida Serena Lee and Jessica Durrell. The world is waiting for you to show off your unique gifts. It starts with healing yourself mentally, emotionally, physically, and spiritually. Once the scars of our past are gone, we can truly begin to shine. Listen live every Tuesday at 2 p.m. Eastern Time and 11 a.m. Pacific on Voice America Health and Wellness.
Have you friended us on Facebook yet? Why not? Just go to facebook.com/Voice America or search for the keywords Voice America. Once you are part of our Facebook network, you'll receive daily messages about what's happening with our shows, this week's featured guests, and new happenings at the Voice America Talk Radio Network. And you can add your voice to the always active discussions on our timeline. Just go to facebook.com/Voice America or search for Voice America.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Jennifer Block, and we're discussing her book, Everything Below the Waist, Why Healthcare Needs a Feminist Revolution. So, Jennifer, before the break, we were kind of diving into C-sections and episiotomies and that kind of thing. What's kind of the scoop on that? I mean, a lot of people think C-sections are, I mean, there was a fad, I don't know if it's still going on, where people would book their C-section and have their birth that way. What's kind of going on there, and why is this something we shouldn't be choosing? And go, you got 5 minutes.
Well, I don't know how much of a fad it was, to be truly honest. You know, there was my research, you know, the physicians I talked to, yes, there were, you know, pockets of the country where physicians were telling me, like, you know, 1 out of 50 patients was coming in asking for a C-section. But when I talked to patients in the Midwest and, you know, not the glamorous coasts, they had never heard of that. So, you know, I think that that narrative was really more sexy to the media, and also kind of like something that physicians were happy to engage with, because, again, our system does not support physiological birth very well. You know, I used to work in restaurants, and the way I think about someone trying to have a physiologic birth in a typical U.S. hospital is that they're going into a restaurant and sitting down and drinking the free water and eating the free bread and not ordering anything off the menu. And if you're waiting tables, you do not like that family who's doing that, because you're not going to get a tip, right? So in our fee-for-service system, you know, if you're going into a hospital and you're trying to move around and you're trying to avoid an epidural and avoid Pitocin and avoid the interventions that often lead down the road to a cesarean, you know, you don't belong there. So it was a convenient narrative to talk about, oh, well, women want this, you know, should we be doing it? So now the conversation has definitely changed in the U.S. because we have a rising maternal death rate here, rising. Not only has it not budged, it is rising, and it's rising among Black women especially. And there is a relationship to cesareans, because one of the main reasons for maternal death is hemorrhage. And in this country, it is difficult to get a vaginal birth after cesarean. It's nearly impossible to get a planned vaginal breech birth. Those are automatic cesareans, and a lot of women pregnant with twins typically are told it's going to be a C-section as well. So we set a lot of women up for a first-time cesarean, and then we deny them the option of a vaginal birth, and we have these repeat cesareans, and we see these complications of the scar, the placenta embedding into the scar, causing catastrophic hemorrhage at the time of delivery, and we're seeing this maternal death rate. So the conversation we're now having is not about, you know, whether women should be able to demand, have a C-section on demand. It's really about the fact that this is a public health crisis and that we need to do something about it. And yet, we're not being very bold. The U.S. sets these healthy people goals, and the healthy people goal for 2020 was to bring the primary cesarean rate down to 23.9%, which is, you know, worse than our, worst performing hospitals in the 1980s, before this trend really took off. So it's not a very bold goal. It's still assuming that all the breech babies are going to come out by cesarean. It's not really tackling the VBAC problem. And meanwhile, you know, this is not just an issue of overtreatment, but this is really an issue of human rights and consent, because in every other scenario in medicine, you know, adult patients decide what happens to their bodies, whether or not they get a treatment, or whether or not they're cut open in a surgery. And we seem to just be throwing that principle out the window with pregnant women, where we're just consigning women with breech babies to a C-section, you know, telling women who've had a previous cesarean that they're not allowed to have a vaginal birth at this hospital or with this practice. And we really haven't grappled with that.
It was actually a hard chapter in your book to read. I've heard stories like what you talked about, but I find them really shocking. My mother had 3 children with natural birth, and I was born at home, and the birth stories are told every year on our birthdays. So I was aware that there was a difference with what my family told and what happens. And I've heard stories over the years in practice, but I still am shocked that this still happens, that women aren't given choice. And I think a lot of it comes down to fear, especially if it's your first child or you think something might happen. Women know that the birth rates are high, so they're going to do what the doctor says. And it's hard to choose. But, sometimes it's a little more aggressive and damage is done. I mean, you told some very aggressive stories in your book. And you're right, it is about consent. And I think this is a place where doctors think that the consent isn't quite as necessary because, they can cause fear in the woman and make, I don't know, what do you think? You're the one that wrote the book, I guess.
Yeah, well, I think there's fear on all sides because I think that, physicians fear malpractice suits. It's been, they're in a system where hospital administrators are scaring them with the specter of losing a suit. Their risk management departments are telling them that they can't attend a vaginal breech birth or they can't attend VBAC. And that's all coming from fear that the hospital is going to get sued, fear that the physician is going to get sued, that they're going to lose their insurance, not be able to practice anymore. It's not based on evidence, of course. And the lawsuits, as one lawyer just very eloquently explained to me, those decisions aren't based on medical evidence. They're based on what the other lawsuits, how the other lawsuits were decided. It's very sort of closed system, like unscientific and closed system. So there's fear on the practitioner side, and it trickles down. Nurses fear the doctors, nurse midwives who are working in the hospital. They're in a really tough spot because their model of care is to respect the woman's autonomy and to support the physiology, and yet they're not really autonomous in the United States like they are in Canada and Europe. They're operating under physician supervision most of the time if they're working in a hospital, so they're not really in control. And for women, for patients, yes, I think our culture is just steeped in so much fear about childbirth. And it's fascinating to me that it's only been 100 years. It's only been 100 years, a blip in human history, that birth is something that you have to do with medical technology under the care of a, surgeon in a hospital to be safe. We have this thinking that that's true. And that it's this scary, awful, painful thing. It's only 100 years because before that, this was, under the domain of midwives. And, of course, there wasn't surgery and antibiotics, but they were doing a pretty good job for the time. The researchers who have gone back and looked at those records show that midwives actually did have a lot of expertise and they had skill, and they attended birth as a physiologic event that women did upright, awake, eating and drinking, supported by their aunties and, the other women in the community and the midwife. And there wasn't so much fear around it. And now, in 100 years, it's completely flipped. It's something totally different. And so, yes, I think it's scary. And even if you are aware, maybe you're on Facebook groups, and you are aware of this alternative called midwifery or home birth, it's really hard to get it in some communities, in a lot of communities. Even in New York City, we don't have a single birth center in Manhattan. We don't even recognize the home birth midwife credential, the certified professional midwife credential in New York State. And insurance, it's a struggle to get insurance to cover your home birth. Medicaid stopped paying anything reasonable for it. So if you're on Medicaid, you have to pay out of pocket on top of what Medicaid will reimburse. it's really difficult. So to push back against that system takes a lot of fighting, a lot of work. It takes resources. It takes a social support system. It's really hard to birth in a way that your family doesn't approve of, that your friends don't approve of. People are telling you your baby might die, even though you know that there's lots of research now on the safety around birth outside the hospital. It's really hard to do that. So I think there's fear on all sides.
Well, you can imagine, I mean, my mom had 2 natural births in a hospital, and then I was born at home, and this is in the 70s. So it was even harder then, but it was just something that she really wanted, and there was fear. So the first 2 were in a hospital, and then I was the last, so they felt more comfortable to have the birth the way they wanted. But that's still rare today. It doesn't happen. And, I do think it's that fear. What if something happens? And so you're in a hospital. And then your right to choose is less. And like you said, it's the doctors. Midwives are actually covered here by our healthcare, which is a big step forward, especially if you know what it's like here. We're not progressive usually in that kind of way. But you are still in a hospital, and there's still a doctor there that will have a say over the midwife. From what I understand, I shouldn't say too much because I've not been in that situation. But there's also, I think, if we want to talk about the cultural perspective as well, there's also the choice, as you said, with what your family thinks your birth plan should be and the choices that you should make there instead of what's right for you. There's a lot of like parent shaming, mother shaming, do things this way instead of doing things that are right for your body. And I think we've lost touch with that part of it.
Right. Well, and also like what we mean when we say, a good outcome. Like, for women with complicated situations, they're not just interested in surviving. I've talked to women who have had 2 C-sections, and, they were so traumatic, and they're so, the recovery, both physical and emotional and psychological, was so long and arduous that they just they can't go through it again. They're pregnant again. They cannot plan another C-section. And so, they do have a little bit higher risk. They have a risk of a uterine rupture. They have a risk of the accreta that we were talking about. But C-sections also have risks. We forget that sometimes when we're having this conversation about the risk of a vaginal birth after cesarean, that C-sections have real risks, but also we need to think about the values and the real life experience of the person in front of us. And if someone's saying, I cannot go through another surgery, I won't be a good mother, I won't be, my mental health will be in jeopardy, then I think we have to listen to them and recognize that, just merely surviving is not the goal. That can't just be the goal. And the autonomy of the person in front of us has to be paramount. And again, like that's just routinely being tossed aside. As someone said to me recently, you're expected to just leave your autonomy at the doorstep of a hospital.
Yeah, well, I agree with you on that one. And, I think this comes back to where we started the conversation of, women's health and women's organs aren't treated with that respect. So if, she has nerve pain or chronic pain coming out of that, it's not valued as much as if it was, I would guess, in a man's situation. But men aren't even in that situation. It's more, is she still alive? Okay, well then, here's some medication to cover up the nerve pain that was caused by your C-sections, plural, and off you go. And it takes a long time to come back from something like that.
Right, and it puts women more at risk for problems with incontinence and pelvic floor prolapse, and, poor childbirth treatment can mean these really, debilitating quality of life issues down the road that lead to more intervention and more risky treatment. So one of the other things I look at in the book is the disaster with pelvic mesh. with the transvaginal mesh kits that have been marketed to physicians to take care of incontinence and pelvic floor prolapse, and the controversy over the morcellator device. I guess your listeners might have to Google that. I don't know if we have time to get
Well, they're going to have to actually read your book, so this is a good place to end. You do go into great detail about that, which I think is important. I think it's important to know the choices that we have if we're in those situations, and even if you're young, it could happen later. So I'm going to, if anybody wants to read your book or if they need more information, how can they do so?
Yeah, the book is online. You can find it at your favorite online retailer. If you look at IndieBound, you can find it at your local bookstore, which I root for. And you can follow me at Writing Block, the pun, Writing Block, on Twitter, and Jennifer Block Author on Instagram and Facebook. And you can find my website as well, jenniferblock.com.
Well, perfect. Jennifer, I want to thank you for joining me today. It was a great show.
Thank you so much. Thanks for your questions.
Perfect. If you want more information about my story and what I went through on my journey back to health, you can find that on my website at dr-risk.com. Don't forget to follow me on Facebook, Twitter, or Instagram. And just thank you so much for listening today. Be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.